Rashmi Deshmukh for Evolving Trends in Keratoconus.
Thank you, ma'am. At the outset, I'd like to thank AIOS for the opportunity to present this study. There are no financial disclosures. So keratoconus was initially described by Benedict Duddell in 1736, and even more than 250 years later, we still think that it's an enigmatic disease and it's not fully understood. Everybody is trying to make a difference in the management of keratoconus, considering that even cross-linking can only halt its progression. There are enough number of studies and there is data from various parts of the world, but there is a paucity of literature when it comes to Indian population. So there are several unanswered questions when it comes to our population per se. We wanted to look at the epidemiological data from Indian population and also how has the trend of keratoconus changed in India, considering that there are now advances in diagnostics and management protocols and also in the disease understanding. So the aim of this study was to describe changing trends in keratoconus patients presenting to a multi-tier ophthalmology hospital network in India over 3 decades. This was a retrospective hospital-based study conducted from 1987 to 2020 data, and any patient who had a clinical diagnosis of keratoconus in at least one eye was included, and descriptive statistics was used to elucidate the demographic data in this. Coming to the results, we had 20,576 patients who presented over 30 years, and 63% of them were males and 37% were females. Looking at the trend of how the patients have presented, if you look at 1987 to 1991 block, we had only 173 patients, but now in the past 8 to 10 years, we have more than 14,000 patients of keratoconus who have been diagnosed. Looking at the age trend again, initially, the age at presentation used to be close to 30 years, but now the age at presentation has dropped down to almost 22.2 years. Then coming to the management protocols, we see that the overall trend of management or the interventions being done, which is represented by the blue line here, has increased. And looking at them individually, we see that, so the red arrows here are representative of when the contact lenses were respectively introduced in the contact lens management for keratoconus. And when we look here, the trend has been increasing. And now almost 11% patients are being managed with contact lenses for their visual acuity. Looking at collagen cross-linking trends, again, it was introduced in 2003 and we started doing it in around 2007. And now more than 6.6% patients are benefiting with collagen cross-linking. And then looking at the keratoplasty data, initially 100% patients used to undergo penetrating keratoplasty. Then somewhere around 2000, 2001 was when the lamellar keratoplasty was introduced and DALK started being done. But now almost 75% of the patients require collagen cross-linking and keratoplasty has come down in the practice management. So coming to the discussion why this study was important is that keratoconus was originally classified as a rare disease by the NIH, and it has a highly variable incidence rate which is reported. But it is also known that this is affected by the ethnicities, geographical area, genetics, and the diagnostic methods used by these different countries in their respective data sets. But we do know that nevertheless keratoconus is much more prevalent today than it was originally thought. Within the United States itself, the incidence has increased from 54.5 in 100,000 patients to 1 in 375 now in 2017 as reported. And this study from the UK has shown that keratoconus was 6 times more common in Asians than in white population, but we have very little literature from our population. There were 2 studies that I came across in India, but both were cross-sectional studies with relatively low sample size, and the criteria used for the diagnosis of keratoconus are also obsolete now. And when we look at the studies that have shown trends, there's only one study which has shown a 48-year trend from 1935 to 1982 and published in 1986. Since they had a very small sample size, there were no significant trends that they could enlighten us with. And since then, advances in diagnosis and management techniques in keratoconus have been seen, which would affect the trends that we see now. So what was already known is the prevalence of keratoconus has increased globally in the past few years. It is very common in Asians, but there's paucity of literature, and our understanding of keratoconus was mainly based on data extrapolated from other countries' studies. This study adds an increased understanding and better diagnostic modalities and newer treatment options have changed the demographic picture and management protocols when it comes to keratoconus. And this is the first study of its kind analyzing epidemiology and trends of keratoconus over a large data set over a long period of time. So to conclude, majority of the keratoconus cases that we saw were between 10 to 30 years age group with a male skewing. There is increasing number and earlier age at diagnosis and presentation. Contact lenses and collagen cross-linking are definitely game changers in the management, and there is a reduced number of keratoplasties that we see now. This study has given us a better understanding of the pattern of disease presentation in India and helps in the in improving the management protocols that we would follow. Thank you.
Very nice, beautiful demographic study, Rashmi. What were your diagnostic criteria, and did you include formifraste or subclinical keratoconus also in this?
So diagnostic criteria, because because it has been studied over 30 years, this data. So whatever the diagnostic criteria were prevalent for that particular time frame and the diagnosis has been made as keratoconus by the clinician, those were the cases which were included. So for example, now we have Steinfluck topography and we might look at different trends, but when we had placebo-based topography and that time if it was fitting into the criteria, those patients were still included. So that is why we are looking at the trend. Because based on placebo, we had the age at presentation 30, and now based on our data, it's come down to 22. So that itself is like a trend shown on the advances in diagnostics. That is one thing. And one more question you asked, ma'am.
And formifraste and subclinical keratoconus, did you include in this?
They were not included, ma'am. Diagnosis of keratoconus in at least one eye.
Is it eye-wise or patient-wise?
This is patient-wise because there were 20,000 patients. So the patient number itself is more. But the 14,000 patients of the last 10 years, we've studied eye-wise, but we've published it. So.
Have you done a breakup state-wise or region-wise in India? Because we know it is an established fact that the keratoconus incidence is more, the prevalence is more.
Yes.
But is there a demographic distribution that you figured out whether it's more in North India, South, East, West?
We have not been able to do that because this study was across the network of LVP. So the network is from Orissa, a small part of Karnataka, mostly in Andhra Pradesh and Telangana. So we could include only patients draining in those areas.
That's from one region. And the other thing is that would you want to break it up into as it's actually more incidence, or is the pickup better?
So actually incidence this is a prevalence based study. Incidence we might have to look at more details, which would be difficult with the 20,000 data set. Also considering that at that time the kind of data that was being entered, because this is a retrospective analysis. So there is a lot of data which we might not get. For example, even when we looked at, in the interest of time, I have not included those results, but when we look at the family history pattern and those things, we had like 1.4% patients who had family history or 5.7% patients who actually had eye rubbing. But in 1980s and towards the late 1980s, when we look at the records, they would not even document it because that knowledge was not there at the time.
But what
now
was
we
the aim of this paper? I mean,
to
we
look,
know.
To look at the
it's an
demographic
established fact that the prevalence of keratoconus is more.
It is an established fact from Middle Eastern and American studies, and maybe one study from Korea. That is the only Asian study. We don't have any study from our population. So if we want to make a difference in the management of our patients, we need to know the presentation of our patients itself.
So can we look at a retrospective analysis of a multicentric approach, or maybe look at it deeper into the regional distribution within India?
If it is possible, I mean, if the geographic areas and everything have been documented properly, because in a large data set, when we look at retrospectively, it depends on how it has been documented a lot.
So more work needs to be done.
Yes, it's a lot. Even this was like a lot of work, but when we go for geographic distribution, we might need more.